Peter, that was brilliant, and thank you for rocking the boat and challenging us. Say a few words, if you will, on the cost of inaction that may potentially relate not only to not doing things and focusing on that critical time window for child development, mental development, but also what else occupies that space. So if you don't occupy that space with positive inputs in optimizing growth trajectories, developmental trajectories, opportunities for early education, family support, and I'm reflecting on countries where there is undue conflict, exposure to a lot of adverse influences, what else occupies that space? I mean, the cost is not just cost of not doing things to those nations, but to the globe as a whole by the promotion of a lot of the lost generations from lack of positive exposures and being exposed to a lot of the negatives that come in that space.
Well, I think we actually had an advance in the framing from the old MDGs to the post-2015 goals that I was critical of a moment ago. But one of the main changes, in addition to the concept of universality, which is, I think, a good thing for the reasons I mentioned. Again, I'm not a post-2015 expert. I'm not an expert in anything, it turns out. Is that the missing themes, if you will, some of the other things that would occupy that space, things like joblessness, things like peace and conflict, things like environmental sustainability, they're all there now. So I think, and you said it yourself in your question, Zulfi, those are the types of challenges, whether they go positively or negatively, that are in competition in scare quotes, with the type of challenges that were in the old MDGs, women and children's health, et cetera. I actually think that and I come back to this idea of a unifying theme, there's a great opportunity in that. That ship has sailed, that is there, but in fact, that's an opportunity for a field like child development, because child development is hard to shoehorn into a narrower framework like the older MDGs, because it's got such important antecedents in things like peace and conflict. It's got such important outcomes with respect to things like employment and joblessness. And so I think that is the suite of ideas, and I hope I haven't misinterpreted your question, that is the suite of ideas that can occupy the space. We actually now have a situation where those ideas all are in competition. They do need to be unified, and I think that does present an opportunity for child development. I'm not sure I got to the nubbin of your question, so we may want to follow up later, but that would be initial take at it. Please, Pamela, and we'll just go around.
Hi, Pamela Collins from NIMH. Thank you. That was a wonderful presentation. And it's a wonderful follow-on on a piece of a conversation that we began yesterday. That was about the tension between slicing and dicing, in fact, so that pieces of what one wants to do can be sold to policymakers perhaps more easily versus articulating a unity or a whole that may be viewed as too complex, too expensive. And I just would like to hear your comments on that. This is relevant to the conversation we had about mental health yesterday, but also quite relevant to, obviously.
So I think it's a great question. I think my response would be horses for courses. So I think we have not adequately made the holistic communications message. We have not adequately integrated it into women and children's health and other areas. And your work, actually, of integrating mental health into existing health delivery platforms, for example, for women and children's health, is a great example of actually starting to do that. So on the one hand, I think we need to make the strategic message much more clear. On the other hand, I fully acknowledge that there are situations where tactically the right approach would be capture 17 hills and then unite them. So, and it may well be that the post-2015 goals are an example of that. It may well be that with just over a year to go, it is actually now very unlikely that a single or overarching challenge would be framed. I actually don't see that happening. I do think it's possible that the language, an aspirational language, could help to unify a narrative for the goals, and that would then increase the focus on child development or its efforts. I think that's probably the best that can be accomplished at this stage. I also think that there's not a bad scenario here of sticking it in every little spot, as I argued that it was, because I think it is there, sliced and diced. If there is a clear follow-up effort, then to pluck those pieces and unite them in a whole under a parallel effort beyond the post-2015. And that's also tactically or maybe strategically a way to go. So I would say, Pamela, I think one needs both, the kind of holistic framing of the argument and the tactical slicing and dicing and capture every hill. I think that I think we've probably done too little of the holistic narrative, but I do think that the narrative should be pushed, even though it likely, in my opinion, and there's other people here who know much more about the post-2015 goals, likely won't yield a single goal, but it'll get us closer to an alignment and closer to a jumping off point that could then be the beginning of a parallel effort. Because at the end of the day, these goals will need to be implemented by a consortium of actors. And by the way, they always tack on a partnership goal at the end. And that partnership goal is usually extremely poorly formed and poorly thought out, which also presents an opportunity to say, well, for that partnership goal, we're going to use, I'm a little biased here, but something like a grand challenges approach to governance, and we're going to focus on child development, and we have a child development partnership, and that's going to integrate with other elements, et cetera. So I think both. We have till past, is that right? Or, okay, so I'll just go, please, and then we'll, yeah, go ahead. Parfait, I loved your Las Vegas quote. I was reading the tweets yesterday. I thought, holy smokes, this guy, I think actually you want to change spots because you're like a brilliant communicator.
Okay, actually, yeah.
Sorry, was there anything else?
and spoil the fun? No. No, I actually wanted to congratulate you. This is actually easily one of the best presentation I've heard in a long time. And so if at the end of this you're not an FOZ, maybe you can be a FOEE, which is a friend of everybody else. There's a lot to take, that I take personally from this communication. One is the how do we tie early childhood development to national development as a whole. I think it's for those of us who work in international development, it's a critical area to be thinking about. The other is the main idea of being lost in translation. And so my question to you is, where do you think this translation should occur? In this forum, we have many brilliant ideas in different places. Where are you going to take the next step and do this translation?
Thank you, Parfait. Let me just land on two parts there. So I was actually a health researcher for 35 or 40 years. And over that 35 or 40 years, what I learned was if you leave the translation, policy translation, knowledge translation element to the end of your research, it will fail. And one really needs to begin to think about the translational framings right at the beginning. So for a forum like this, I recognize that this is primarily an evidence synthesis. I mean, that is the goal of national academies, evidence synthesis recommendation. At the same time, framing matters. And I think it's worth thinking about the framing of these issues and how they will be translated and what is the communications and advocacy piece right at the beginning, even if this isn't primarily a communications and advocacy exercise. And for those of you who worship at the Church of Health Research or other forms of research and you find this a non-kosher approach, just think about it as knowledge translation, which is a pasteurization of advocacy to suit the health research community. I want to land, though, on the first point you made, which I think is extraordinarily astute. Think about our model now. So our model is domestically, I'm talking about Canada, the United States, Europe, domestically, almost all we're focused on now in terms of our policymakers and our governments to a greater or lesser extent is economic development. We focus on innovation. We focus on infrastructure. We focus on investment. We focus on the human capital of our population. We focus on training. Those are the things we focus on domestically because we want to have prosperity. When we turn around and we think about foreign aid, we just don't think about that. That is not our primary approach to foreign aid. It is handouts, it is charity, it's a different mode of thinking traditionally. Why don't we just think about aid in the same way as we think about our own domestic prosperity. Now, having said that, the key issue, of course, is not aid. It's what you talked about, which is the domestic policies in countries themselves throughout the world. And this kind of thinking on child development, on human capital, I would say would resonate with finance ministers in developing countries. You know, we had a visit in Ottawa of the top foreign affairs official from South Africa. And he said, my number one priority is the workforce, human capital for purposes of productivity. This just illustrates that. And after we were done talking, he recognized that actually the way to implement his number one priority is through early child development, because it's the first skills training. That's the way we need to think. Whatever we would do domestically to improve our economies, to pursue our social policies, is actually, why wouldn't that be a way of thinking domestically in our partner countries as well? So thank you for that, and really appreciate that intervention. And if I'm just an FOP, that's good enough for me. I'm going to go more quickly. Gary, Atif, and then here. I'll take a couple of questions, maybe just to make sure we end on time, a few at a time. Gary?
Peter, thank you. I think one of the things that we're all here to try to figure out is exactly what is the role of this forum vis-a-vis other efforts that are going on in early child development right now. And I think you've issued a grand challenge to us to think about the translation of evidence into policy. And what would be your recommendations as to the specific role of this IOM forum in that process?
Okay, thank you, Gary. I'll just take a couple. Atif?
Thanks, Peter. Fantastic talk, as usual. I wanted to just say about the bottom-top approach. You know, when you took a poll, we were all, you know, we all have aspirations about our children. You know, we want them to have the best potential. And just looking at the work, the sort of work that Autism Speaks does, for example, giving parents a platform to really push the agenda and bring it and highlight it, whether there's some potential for organizing parents to push this envelope.
That's a great point. Please.
Thank you. That was inspiring, and I think it helps unify a number of the initiatives that many of us are individually, entrenched in, and are trying to move forward. So a unifying approach, I think, makes a lot for bringing together the energy and the momentum needed. In the end, as you said, we still have to conquer each one of the hills. We also have to face the fact that in the end there is a finite human and economic capital. So how do you prioritize the hills? How do you define which one do you take first, or do you try all of them at the same time? Because the unifying approach sometimes I think is hard to go after because it just seems a little further away. That's why survival sometimes makes herds. It's a little bit clearer, easier to define.
Thank you.
And we've gone after it.
Thank you. Please.
Just one last question. Thank you very much. I think your talk really summarized a lot of the issues we struggled with yesterday. I'm Rana Haji, CDC, by the way. I just, I usually don't like to list failures, but I think would like to add to what you said. I think it's a good approach. And I'm wondering, along the line of communications and helping us as a forum also trying to, have more impact. I mean, I know we want to synthesize information, but I also think part of our role is to identify the key gaps that are needed for implementation. I'm wondering if one of the critical failures is also our inability to link the inaction or the cost of inaction, not just in terms of dollars, but in terms of other impact to the rest of the world. I mean, one of our great public health leaders, Dr. Bill Foege, always says that we need to take advantage of the fears of the rich to benefit the poor. And, and I think, there's a huge cost in terms of even word stability and what many of these countries are worried about to the cost of, ignoring child development. Take, for example, what's going on in the Middle East right now and the huge number of refugees that are all over. You have just in Syria alone 4 million children who are actually not in schools right now. if we ignore these kids, I mean, what's going to happen to them in a few years and the impact they will have on the rest of the world? And I'm just wondering if you know of any initiatives that are trying to link, because policymakers always see the short term. They want something they can do during the time they are in their positions. And how can we better communicate to them the long-term impact? Thank you.
Thank you. Maybe time for wrap up.
Yeah, we have one final question from Constanza. It's going to be in Spanish.
Okay. Hang on, Constanza. Constanza, hold the phone.
Bueno, ok. ¿Listo? Ok, buenos días. Yo soy Constanza Alarcón y creo que tengo un lugar un poco diferente desde el punto de enunciación. Yo trabajo directamente con el gobierno nacional, entonces estoy del lado de los planificadores de política. La intervención suya ha sido fundamental, haciendo un llamado a varios de los aspectos que hemos venido revisando, y creo que este punto toca ya como una decisión muy importante de cambio de paradigma en la forma también en que la ciencia, en que la academia, la investigación está mirando el desarrollo infantil. Esto no se trata de buscar como que qué fue primero, si el huevo o la gallina, digamos, si la academia no responde o si es que los planificadores de política no revisan. Porque hay un intento, estoy hablando de la tendencia al menos de los países de América Latina, de transitar hacia paradigmas de políticas integrales. Hay preguntas por una mirada holística del desarrollo infantil, hay pregunta por el trabajo, la intersectorialidad, hay preguntas por la arquitectura institucional, por el costo-efectividad de las intervenciones, pero uno voltea a mirar también con miras a soportar decisiones en evidencias y en hallazgos, y nos encontramos también en una academia que necesitamos que transite hacia comprensiones holísticas del desarrollo, que dé respuestas mucho más contextuadas, particularizadas, pertinentes, y que uno sienta que hay respaldo también en decisiones, porque eso lleva en muchas ocasiones a que las decisiones sean de muy corto plazo, porque evidentemente no hay toda la seguridad para hacer inversiones y poder llegar y llevar a los gobiernos a transitar de políticas de gobierno a políticas de Estado. El ejercicio es muy puntual, acciones muy de pronto sin contexto, y uno pierde también sobre eso un poco la posibilidad de diálogo y de encontrar esas narrativas a que usted hace referencia. Entonces, en eso, digamos, la inquietud un poco es que si usted conoce o miramos o hay alguna sugerencia en torno a cómo también debemos transitar desde la academia para lograr ese reto de esa mirada del desarrollo integral, de esa forma intersectorial de gestión de la política.
Thank you. So just to quickly respond to those and then wrap up, because I know time is moving on. I thought Constanza's response actually, and I know it was a question, but it's actually probably the best answer to Gary's question about the role of the role of this forum. I think that the value of this forum can really be to foster the interplay between real examples in countries. And I note you're going around the world, actually going into locations where hopefully you could actually see things for yourself, between those real programs and the types of evidence that you're synthesizing, because that would mean that that evidence is actually in support of the actual decisions that are needed in countries. And I recognize that most of my remarks were at the global level, so actually Constanza's point is a very nice complement to that. I think one needs to go back and forth. So for example, when the President and First Lady of Peru visited Canada last week, the First Lady, or the wife of the Prime Minister of Canada, is actually the honorary chair of our Saving Brains program. And you can see a conversation flowing about the Peruvian program Cuna Más, which is a very interesting early child development program, and the types of evidence that's coming up in the Saving Brains innovations. That's the type of interplay, I think, that's needed in the forum. I recognize that the primary comparative advantage of a national academy is evidence synthesis. And Constanza very well pointed out that that is a key value for country decision makers, because it also comes with the legitimacy of a type of level of quality in a brand. But you need to actually have decision makers at the table, policymakers like Constanza, who works with the presidency of Chile, right the way along. And I see Andy is nodding because some of the questions that came up, and I'll just hit some of the other ones, like how many hills do you capture at the same time, engagement of parents. I mean, you have people in your midst like Andy who are much more qualified to answer those questions of framing and advocacy. So it gives us a tough challenge here at the forum. But maybe the way I can just end is to say that I think that you should not regard this evidence synthesis that you will be doing, and I know you don't, but in the worst case scenario, it's not occurring in a vacuum. You know, link it as closely as you can to the real challenges and the real programs in countries. Prioritize the discussion at the front end of people who are actually struggling with investment decisions in countries. So in a country like Peru, you know, how much money do you put in Cunemas versus how much money do you put in other areas? What are the outcomes that you're getting from a program like that? These are the types of real questions that I think can inform the work. So I don't want to kind of subvert or change the direction of the forum. I've just seen so many academic exercises, and even exercises within national academies, that end up with syntheses of evidence or recommendations that do not hit the mark because they are not responsive to the main questions that are actually being asked by country decision makers, by global decision makers. And maybe that's the best synthetic answer to the lost in translation question. It's almost like a process answer. It's the inclusion at the front end of people like Constanza, who are working in the presidency in Chile, to challenge you as you go along, to make sure that the evidence that you're synthesizing is relevant to actual decisions that actually need to be made at the country level. At the global level, I think we had a more robust discussion of that. I mean, for example, why is it that, to my knowledge, nobody has actually tested the survival message against the thrival message with communities of parents? I mean, wouldn't that be an immediate thing to do? I'm not suggesting that's the role of the forum to do that primary work, but it's those kind of gaps that you begin to identify when you really start to think hard about the translation issue. So I didn't robustly answer every last question because I really wanted just to make sure as many people as possible had a chance to make their comments. But just to summarize, I really, really admire the work you all do individually and what you can achieve here. At the same time, right at the front end, let's really think hard about what we want to achieve. We want to achieve not only a set of national academies, reports, resources, et cetera. We want to achieve action in the real world. We want that translational thing to happen. For it to happen, the forum actually needs to engage the people struggling with those actual decisions, be it at the global level or be it at the national level. You actually have many of those people in the room. I would just say prioritize their voices up front and see the evidence and economic synthesis as responsive to those real challenges in the real world, because at the end of the day, that, I think, is what we want to achieve, a transformation in the lives of as many children as possible, and everything else is a vehicle to get there. And maybe if we just think about that impact and work backwards from there, that would be a way to move forward. And I don't think it actually is a fundamental change in what you're doing. I think it's a reframing, maybe a slight framing issue at the front end and a slight process issue as to who says what when. And then with that amount of tweaking, I think you'll solve this lost in translation failure and ultimately yield a huge, huge success for the children of the world. Thank you very much.
Thank you, Dr. Singer. We'd like to have the next panel come on up front.